I'm Amanda Olson from IntimateRose.com, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And I'm going to be explaining how to use the new blue vibrating wand to address tender points and trigger points through the anus. The blue vibrating wand can be turned on using the on button, and then you can hit the vibration button to find the frequency of vibration that works best for you. There are 10 frequencies to allow you to find the perfect one for you. On the blue wand, there are two different ends. Either end can be used rectally to address tender points associated with tailbone pain, pain with sitting, pain around the hips, or pain around the prostate. But we recommend that when you're first starting out that you use this longer, thin end to allow your body to adapt. When you're going to use the wand, you're going to wash it with warm water and soap, and then you're going to find a position that's comfortable for you in a comfortable location. Most people do it on their bed or on the floor on a mat. You can lay on your side, so this is your pelvis here, and this is the back, and then your spine goes up this way, and then your legs would be here. So you can lay on your side, or you can lay on your back with your knees bent. I always recommend having two pillows on either side of you if that's the position that you're using. You can also lay on your bed facing the wall or the headboard and have your legs up on the wall there with your knees open. So this is just going to allow you to get good access. If you're laying on your side, prop the top leg up with a sleeping bag or 2 or 3 pillows just to get your knee elevated and allow your hips to relax. The first thing that you're going to do is you put lubricant on the tip of the wand, and you're going to be breathing nice and easy. You're going to bring the tip of the wand to the tip of the anus and continue to breathe deeply. When you're feeling ready, you're just gently going to press the tip in. For the first time, we always recommend that you only go in about 1/4 of an inch just to get your body used to having something there. You're going to continue to breathe, and then when you're feeling ready, you can progress to more of 1 inch to 2 inches. And at that depth, so here's the wand, here's the anus, you're putting it in about 1 inch or 2. You can then gently sweep down in a little circle. So this is what it looks like on the inside. So you're just sweeping for tender points or restrictions. When you're using the wand, you're never pushing any harder than you would use to check a tomato for ripeness. So if you can imagine, you're checking to see if the tomato is ripe. You're not impaling the tomato, just like you're not going to push too hard with the wand in your body. Once you've cleared that depth, then you can go a little bit further. You can go up to the 3-inch mark and continue that gentle sweeping motion. When you locate a tender point, pause and hold it for about 1 minute or 2. You can also move your leg gently. So if you have the wand on a tender point and it's feeling like a throbbing or a zinging sensation, make sure that you're only maintaining gentle pressure, and you can lift your leg and lower it, or if you're laying on your back with your knees bent, you can bring your leg out to the side. Rotating the hip helps to relax and shorten the pelvic floor muscle, which can be helpful in gently releasing tender points in the pelvic floor. One thing I want to note is that here's the anus and here's the tailbone. So if you're experiencing tailbone pain, the best route is going to be to direct the tip of the wand into the anus and then just gently straight back. If you're experiencing tender points in the side walls of the pelvic floor, the best route is going to be to come in to the anus and come to the side. We always recommend working one-on-one with a pelvic physical therapist or occupational therapist to help guide you in where your unique tender points are in your pelvic floor and to provide a comprehensive plan of care to you to help manage your pelvic pain. If you don't already have one, you can email us and we will help you find one in your area. If you have any other questions, please don't hesitate to reach out to us at support@intimaterose.com.